Hello, everyone. My name is Dorodi, and I work with Keystone Human Services International. At Keystone, we work on ensuring that every person with a disability, particularly those with intellectual, developmental, and psychosocial disabilities, are able to live full and meaningful lives in their communities. A critical component of living in the community is access to the right kind of care and support. Now, there's a lot of discussion around care as a critical part of decent work. It is linked to the discourse on unpaid labor, domestic work, etc. However, when it comes to disability, the entry point is often from a burden of care lens and not always from a human rights lens. The UN Convention on the Rights of Persons with Disabilities, or the CRPD, and subsequent scholarship and jurisprudence shifts the paradigm of traditional welfare-based, often protectionist care to a rights-based model, where persons with disabilities are not just recipients of care, but they direct the care and support the need to live independently, putting the concept of choice and autonomy at the center. Together with this, the concept of persons with disabilities as caregivers themselves also plays into the conversation. But what do all of these really mean in reality? Today, we have with us two very well known experts to unpack what care and support looks like in India. Shivani. Shivani Gupta is a senior inclusive design manager at the Global Disability Innovation Hub. She has over 25 years of experience in the field of disability inclusion. She is passionate about promoting independent living for persons with disabilities in under-resourced settings. She holds an MSc in inclusive environments and also has a PhD, where her thesis examines support structures for people with disabilities in rural India. Welcome, Shivani, and thank you so much for giving us your time.
Thank you, Dorodi. It's a pleasure being here. Thanks for inviting me.
We also have with us today Sadam Hanjabam. Sadam is the founder of YAL, which is Northeast India's first registered queer and youth-led focused organization based in Impal. He's also the curator of Asia's first all-trans men football team. YAL was listed among 10 global initiatives led by queer people fighting an inclusive fight around the globe by the United Nations. And Sadam has been widely recognized as a leader in this space. Welcome, Sadam, and thank you also for giving us your time. Thank you for joining.
Dorodi.
I love your backdrop. Okay, so let's start with the conversation. I'll start with Shivani. So Shivani, what do we understand when we say care and support services for persons with disabilities? What does it encompass? What does it mean?
So as you know, Dorothy, disability is a very heterogeneous group. And people with impairments actually become disabled because of the barriers that they encounter. Now, the barriers that they encounter can be physical, institutional, and all of those. Now, when people with disabilities really want to participate on an equal basis with others, of course, one of the precondition is a accessible physical environment, but that is not adequate. What people with disabilities also require is support services. And some people with disabilities, including myself, require also care. And what these really entail is really disability specific. For instance, a person like me who is, a tetraplegic requires a personal assistant, not only, when I travel, but also in my daily living activities. But, people with hearing impairments may require sign language interpreters. People with vision impairments equally may require, maybe readers when they are studying, or, people to support them in taking exams, and, so there are very many of these reasonable accommodations that people with disabilities require based on their disability. And these are what really constitute, the support or the support services that people with disabilities require.
Let me ask you then, there's clearly a linkage between accessibility, personal mobility, and care and support. But when you talk about persons with high support needs or persons who need support with their, activities of daily living, etc., how when has care and support become slightly limited to that conversation, and it doesn't really talk about different other kinds of the range of support and care that should be available to persons with disabilities, that it has it become slightly limited for persons with disabilities in terms of how the society and the stakeholders perceive it, from because it's when you talk about care for persons with disabilities often seems to be from the lens of a burden of care, not really as something which is essential and critical for independent living, right? So how does that apply to persons who have high support needs, for example? What does it look like for them?
So presently in India, support services are really not developed. And when we're talking of high support needs, now people may have individual requirements. And, when we're talking of support services, it's generally, okay, sign language interpretation, we have accessible environment, and so people can participate. But for high support needs, I think it's a very complex area. I mean, there are many aspects to it which require unbundling, interrelated, and there isn't adequate, discussion or adequate research or, strategies to even look at these. And for instance, I mean, I know the National Trust has some, they've developed some kind of supported decision-making mechanisms and things like that. But that definitely is not adequate for the person to live independently in the community. I think we need to really break this up into different things. For instance, simple thing like rehabilitation. People with disabilities in India do not have adequate rehabilitation facilities. And if you are not rehabilitated, then your requirements increase. And because support is presently just seen as something that the family needs to provide, it is not recognized, and at the end of the day, in the family, it's the women who are providing. And, this whole thing, the way it is presently functioning, actually makes it like a burden. So, yeah.
Thank you, Shivani. And I think it's a you're right. It's a quite a range of different kinds of support that needs to be available to begin with to all persons with disabilities. This is also oftentimes individual, right? So the support has to be individualized, has to be customized, and I don't think we're having that conversation yet at all in this country and many other countries of the global south. You actually touched upon a very important point, and that's a good segue for me to also move to Sadam, that care and support are often seen as something that should be provided within an institutional setup. And that leads us to, opens the door for so many other issues that we are facing, which is that these institutions become really the center of excellence in a way for of or and the only place within a community where support is even available. And so the whole conversation around transitioning away from institutional setups to community, living really is tied to the availability of support systems and care within the community. Because if we continue to focus on providing care and support institutional setups, then the transition away from those setups would take that much longer. So, Sadam, let me ask you, and because you work on in the intersection of psychosocial disability, conflict, sexual orientation, gender identity, etc., what does care and support look like for persons with psychosocial disabilities, especially from an intersectional lens? What does your experience tell you as to how that discourse should be shaped?
Um, for the situation like Shivani also mentioned, the way of how disability or how persons with disability or the care and support systems itself is placed in the in different in India or in at different states is very it's very unilateral. It goes in only one direction. It's not very intersectional. Now, when one talks about disability, even within the disability spectrum, psychosocial disability is something which is not out there properly, and it's not included much in the larger discourse. And this is treated as something still in a very conflicted zone of whether it's a disability or it's a mental health, a thing. So there's still a lot of, issues in acceptance of psychosocial disability as a disability itself. So along with that, what the society and general people always see is like seeing diversity as something which disability as something which needs to be fixed. And generally, what we feel is that disability is not it's a part of human diversity. It's not something which needs to be fixed. It is something which has existed and which exists. And somehow this is the place where we need to talk about care and support and, and not about fixing or, about making it right according to them. So we have existed and we will live with this condition. But somehow the acknowledgement from the system and the acknowledgement from the society and the larger, the stakeholders, the mindset needs to be changed. And somehow when we talk about intersectionality, like about when I talk about gender or gender and disability or sexuality or disability, this are something which are very new. Because when I work with, because I started working from the sexuality perspective, from the LGBTI perspective, and in that area, there was not much discussion of disability, because it was mostly about sex, gender, and sexuality, and somehow people who have intersectional lives. Like I'm from Manipur. I'm from a conflict zone, and I live with psychosocial disability. And again, I identify myself as gay. And somehow, so there's a layers and layers of issues that comes in. But the way of how the work is done is only done from one lens, like only from my sexuality lens. And when I talk about disability or psychosocial disability, people look at me and say, hey, you have been talking about queerness. Why are you jumping in and talking about disability? So it again is a larger issue which needs to be addressed, and the intersectionality of all these issues needs to be, made more visible. There has to be more platform where we can speak about the intersections. And the work that we do at Yaol and mostly in Manipur and some parts of Northeast is creating awareness about these issues, that that we cannot only talk about one issue. We live in a place like Manipur and Northeast, which has a lot of issues already going on. And somehow, if I just only talk about my sexuality and forget about the conflict, I only talk about my identity and forget about the prevalence of HIV and the kind of emergencies that we face. So there's a lot of intersection which comes in, and we need to address it from today or from tomorrow, and many other people have to start speaking up. Yeah.
So thank you so much, Sadam. So let me then ask you, like, for y'all in your regular work on a daily basis, what kind of services, what kind of care provision do you see? Like, if you have to give me examples of the kind of support services that should exist in the community for persons with psychosocial disabilities with or different kinds of intersections, what would be the kind of support services and care systems that should exist in any community for that matter?
Yeah, for Yaol, we mostly work only with young people. Like, we are a completely youth-run and focused organization. So we work on the intersection of, as I mentioned earlier, also we work on the intersections of gender, sexuality, and also on skills and some parts on health and many other intersections that we are working on sports, using sports as a tool. So somehow for us, the first step, the first initiative that we took was to create a safe space where everyone feels connected and safe and, they feel supported. We didn't provide any service at that time. We kind of, we didn't have that resources, to be honest, to provide support. But the first thing which the community needed was a space where they feel that, they belong there and they don't feel threatened about, about any form of violence from home, violence from the community, or any form of discrimination from the service providers. So for us, what we do was we have a physical space. This is a space that I'm sitting in. This is a physical space in Imphal, which any people, any young people can access to. We have a in-house mental health professional who is from the community. So we also train a lot of young people, peers from the community to talk about, the intersections of gender, mental health, and, HIV, conflict, and many other things. So this is one thing that we do. And second thing is we have a kind of started, how do you say, we have mostly in relief camps for internally displaced children and adolescents, because Manipur itself has been under conflict from last 2.5 years, almost 3 years now. There are still a lot of children and adolescents in relief camps, and there has been a lot of trauma which has been passed down and which they have seen it face to face in Manipur. So somehow we work as trauma response to the children, mostly to the children who are in the camps, because when you put everyone in relief camps, nobody cares about who's a person with disability. Sometimes people with physical disability may be, seen, but young people or children with psychosocial disability cannot be, seen from this angle by anybody. So somehow we reach out to them and we kind of, have this safe circles. We talk to them and kind of at least provide them or link them to service providers after. After doing sensitization with the service providers. Like everywhere in India, there's telemanas by the the National Health Mission. So they have an active helpline number, but somehow again, when it comes to gender or when it comes to children, somehow there's a lack of understanding or the lack of services there. So we try to fill those gaps in Manipur. And we are currently actively working with the Telemanas National Health Mission and doing a lot of awareness in the colleges in Manipur under Manipur University. So somehow there's a lot of things which do at ground, but we do not directly provide any services. And also with TCI, the Transforming Communities for Inclusion, as a part of that, we also do a little bit of awareness on deinstitutionalization, because we have seen that a lot of torture and violence happens in settings, institutional settings, and somehow this needs to be brought forward so that at least this spaces could be reformed for care and support. Yeah.
Thank you, Sadam. And I think an important point in what you mentioned, that the discussion on care and support really begin from having a safe space to discuss the need for care and support, because care and support is often also very personal. So if you don't have the spaces within the communities to even have those discussions, or even within your families to have those discussions, I think it really impacts on your access to the right kind of support. The other thing that you spoke about was belongingness, that you need to have the sense of belongingness within the community, and that also is tied to the conversation around care and support. So Shivani, let me perhaps as we move towards the end of our conversation today, and we could go on and on. It's such an issue where we can have probably like a week-long conversation and still it won't be enough. But given the fact that we do have a time constraints, so maybe I'll as we move towards the end of this conversation, you did your PhD research in rural India, Shivani. So when we think about belongingness, when you think about safe spaces, even when we think about whether a person realizes that they have a right to the kind of care and support that they need to be able to be part of their family societies, is that even there? Is that even a thing in India? And if not, then what are kind of examples that you have seen in your work that really uh, kind of forces us to question how do we then take this conversation forward in a way that it opens up the space for more policy and programmatic interventions.
Dorothy, I think that's really a great question for me. I mean, I did, as like in rural India, what I really saw was people, I mean, the level of stigma and the level of not having any expectations from disabled people is really, really high. So if a person is seen as being worthless, why would anyone want to invest anything, you know? And at the same time, there is an intersection between, you know, with this care and support that people require with the women. And care work or supporting always falls on the women. And of course, there is no additional support, and women have to face the brunt of it, and they encounter like health, physical, mental, social kind of challenges because of these additional expectations. So, therefore, I really, you know, what really came out was that care work needs to be recognized, not only just for women, but also for persons with disabilities, because the experience of women actually reflects on the care people with disabilities face, who then at the end of the day have no autonomy in their life. They are completely dependent on the women's availability, you know, when they may be able to give them time and things like that. And one of the most, you know, a heart-shattering example that I saw when I was speaking to people in the village was, you know, a woman like 30 years of age, and she was a person with high support physical needs, okay? And she had a single mom. She didn't have a father, and the brother was indifferent about, you know, the mother and this girl. So the mother had to really earn and fend for herself. She used to leave in the morning at 7 o'clock in the morning and help this girl, you know, to bathe with her toileting, feed her, and go. And this girl used to sit at the veranda of her house the entire day looking at people going back by. Throughout the day, she did not eat and drink anything because, you know, then how will she manage her toileting? There was no one to support her. And then the mother would return at 6 o'clock in the evening and then, you know, carry her to the fields for toileting and feed her and generally and all these things. And because this girl felt like such a burden on her mother, who had no additional support, she didn't, you know, always ask for the support she really needed. And as a result, her health was suffering. You know, and I asked them, what kind of support do you feel you require? And not being aware of one's lives, not knowing what the other side could look like. I mean, the only support they said, well, maybe if we have money to, you know, eat and live, then the mother wouldn't need to go out to work, and that would be adequate. And, you know, that's the level of lives that people expect that they can live. That's the best, and which is really heart shattering. And we are such a developing country, and we are like one of the biggest economies, and we still have stories like that, and we don't recognize it, which is even worse.
Thank you for sharing, Shivani. And I think you're right that um, there is, I think the conversation around care and support, and that's been a thread in our conversation today as well, really ties in with acceptance of disability, acceptance of the fact, acknowledgement and recognition of the fact that persons with disabilities have a right to live their lives, and not just be confined to their homes. And I think because we haven't been able to move the needle to the degree that is needed on acceptance and on recognition of disability as part of human diversity, I think the conversations on care and support therefore also come in from a slightly um, medical lens or a protectionist lens or a burden of care lens. And I think that's so important to highlight that we cannot talk about care and support. There's a whole conversation ongoing around unpaid care and decent work, but that conversation is not tying in with all of these layers which affect persons with disabilities when it comes to access to care and support. I think it's important to somehow tie those conversations. We cannot talk about care and support without talking about accessibility, like you mentioned. We cannot talk about care and support without talking about safety and prevention of violence that Sadam raised. Those are because again, care is individualized, care is very personal, and there is a whole and the need for safety and security of the person is so important in these conversations. And social protection, even affording the care and support that we need, is sometimes out of bounds for many people and families and disabilities. And I think and so thank you both for flagging those very important points. As we wind up, I'll probably give you like 20 seconds to each of you to just talk about maybe one or two things that you hope that people will start highlighting when they talk about care and support. So then I'll start with you. Like, what are the two things that you wish people talk about when they talk about care and support?
For me, because we work with young people, I would definitely say that include more young people with lived experience in the system, in the policy making, so that the real issues comes in the front, not the percepted ones by the people who are sitting there with no one understanding about it. And another thing is, let's stick to the UNCRPD. It's a basic, document which glows globally, and everybody, adapts to it. So when we talk about including children, when we talk about children with disabilities, Article 7 talks about it. And again, when we talk about Article 11 about, emergencies and risk situations. So these are two articles which I want to focus on again, because of this, because these are certainly the part which are underseen. People living in conflict zones, humanitarian emergencies, and many risk situations. And again, children living under these conditions again. So when it aligns, they become very invisible. So there's 2 points. Yeah.
Thank you, Sadam. Shivani, what would be the two things that you hope that people will highlight when they talk about care and support?
So I'll just continue from where from Sadam, and just like to mention a focus on Article 19 of the CFPD, which is about living independently in the community. I feel that support services should be looked at, from a life cycle approach. And people with disabilities have different needs throughout the life cycle. So it needs to be better elaborated in those ways. I really wish that, there is recognition that people with disabilities actually recognition of the support service needs for people with disabilities when we are talking of rights, inclusion, or anything. I mean, I know as accessibility, a person who's worked in accessibility for so long, accessibility has become a mainstream topic in discussion. And I really hope that care and support have the same kind of recognition going forward.
Thank you so much. And thank you, Shivani. Thank you, Sadam, for your time and talking to us today about this very important topic. And I echo your views and hope that sooner rather than later, we will have a full-fledged, flourishing conversation around care and support, which includes lived experiences, which includes a life cycle approach, and which includes a recognition of the fact that the right to adequate care and support is critical to community living and independent living. We cannot talk about any other right, even education, employment, leisure, any right that a person with disability has, without talking about the support systems that should exist for people to be able to access those rights and opportunities. Thank you so much for your time.